Good afternoon. Thank you very much, Monica, for inviting me to be here with you. I'm honored to be here and to thank you for your kind words of introduction. I only got to be here for the last couple of speakers, so I've missed the beginning, and I understand from what I saw on Twitter that Claudette Commanda opened at some point your gathering, and so I want to acknowledge Claudette and I don't think I've seen her here this afternoon, but glad to hear that she opened your gathering today, and I want to acknowledge the Algonquin people and acknowledge that we are gathered here on unceded Algonquin territory, and our gratitude, my gratitude for being able to gather in this place. I am feeling kind of far away from some of you, and I'm seeing a whole bunch of seats up here. I know you just kind of stretched yourselves by doing some artwork, which I'm sure you loved, but if you feel like stretching yourself and coming forward to fill up seats here, I'm cognizant of the conversation that Jesse brought to us about sort of gathering around the fire, and I'm feeling like the fire, you're far away from the fire. So if any of you at the back want to move up and make us feel closer together, I think that would make me feel warmed by your presence. Je veux vraiment féliciter les organisateurs de cette conférence. Et c'est quelque chose de très important d'avoir une occasion comme ça pour discuter des enjeux qui sont si importants pour les peuples autochtones, mais surtout pour les Canadiens et Canadiennes. Et je veux vous remercier pour votre présence, de tout le monde qui sont venus ici de loin. Et c'est vraiment une occasion très importante. Le travail de Upstream, c'est quelque chose que j'ai suivi depuis longtemps, et je veux féliciter Monica et Ryan et tous les autres organisateurs qui ont fait ce travail pour avoir une conférence comme on a aujourd'hui. I want to also really thank Jesse and Jordan, the two speakers that I did get a chance to hear, for your incredible openness and for sharing. And I learned so much from the words that you said. As Monica said, as somebody who's now a policymaker, I think it's actually more important that I listen than that I speak. And after hearing Jesse's talk, I kind of wondered whether there's actually anything else that needs to be said. So I'm going to go ahead and do my talk, but I really don't think I can add much to the profound stories that you've already heard earlier this afternoon. I come today feeling probably more than usual the fragility of our existence. I don't know, but I'm sure you guys have already talked about this afternoon, but the accident in Saskatchewan has had me feel a little on the edge all day, obviously to no extent close to what families and communities in Saskatchewan are feeling. But as we hear stories like Jesse's and Jordan's, and as we think of the incredible, unspeakable trauma that those families and communities in Saskatchewan have felt, we think about the Stoney Lakota Nation in Alberta that's had its own tragedies in the last number of days. It speaks to the fact that we don't ever know how many days we have. And I think it needs to motivate us all to do the work that's really, really important that we do right now. So I share that just because I feel like I'm coming to you in a little bit of a fragile state, and perhaps you're feeling a little bit the same because of the trauma that we've all experienced, I think, in imagining ourselves in those horrific situations and knowing that there are Canadians who are really, really hurting today. I hope that fragility will inspire each of us to say, in the days and hours, weeks that we have, let's really take action on the things that we've been learning today, and let's really make sure that we give ourselves to making sure that we put the lessons we learn, the stories that we hear, to work to improve the lives of the people around us and the people that we have the opportunity to come into contact with. That's why the work of Upstream is so important, because we're spending time really thinking about how those limited hours that we have can be best to put to use. how we can really make the best use of the resources that are not limitless. And so I want to comment today about some of the things that we've been doing in our own department, and specifically looking at the issue of what does the next 150 years look like, and how can we reconcile in a way that's not going to take 150 years to get there. I wanted to start with a quote from an article that some of you may have read in the Globe and Mail a few days ago, and no, it's not from Andre Picard. There are a few other people that write for the Globe and Mail. But it's by a Dr. Kevin Patterson, who I don't know. Does anyone know Kevin Patterson? Wow, lucky you. He seems like a very wise person. So I was really moved by his article from a few days ago, where he said that there is no greater, clearer evidence of the maldistribution of wealth and of social services in Canada to the detriment of Indigenous peoples than the tuberculosis epidemic underway in the Arctic. And he went on in that really excellent article to talk about the stories of a couple of teenagers in our country who have died in the last year or so, one very recently, with a diagnosis of tuberculosis. And he said that tuberculosis is an expression of poverty as much as it is of a mycobacterial infection. That's what Upstream is all about. A look upstream says that when Canadian teenagers die of tuberculosis, the cause is not just bacterial. The cause is nursing shortages. The cause is language barriers, weather delays, the challenges of evacuations from remote communities, and of course, some of the most overcrowded housing in our country. And Dr. Patterson's article describes some Arctic homes. One of those he describes is the story of 6 people. Well, he says in the article that often there are 6 people sleeping per bedroom. And he wrote of a specific woman in the community of Naujat in Nunavut who said, "These days I have 20. People sleep wherever they can find room to lie down, bedrooms, kitchens, and living room." Canada has clearly failed to address the upstream causes of tuberculosis among Indigenous peoples. And the result is an incidence rate, which may have already been mentioned when you talked about data earlier today, but we know that the rate of tuberculosis among Inuit in Inuit Nunangat, the Inuit homeland, is more than 300 times the rate of tuberculosis in the Canadian-born non-Indigenous population. And for First Nations, it's more than 40 times that high. So I don't need to tell this audience that addressing that inexplicable inequity requires more than biomedicine. It requires the things that I know you've been talking about. It requires addressing housing, education, roads, infrastructure, poverty reduction, and so much more. And on World Tuberculosis Day this year, I had the privilege of joining Natan Obed, who I know was here with you earlier this morning, the president of the Inuit Tipirit Kanatami. And he and I announced together the Canadian target for the elimination of tuberculosis in Inuit Nunangat by 2030, and our commitment to reduce the number of active cases by 50% by the year 2025. We will not successfully achieve these goals unless we deal with issues like housing, unless we work upstream, and recognize that overcrowding rates among Inuit in Nunangat are as high as 52% of homes being identified as being overcrowded. I was very happy that in Budget 2018, there were commitments to address that, $400 million for housing for Inuit in Nunangat. And there is work underway to make sure that that housing strategy, the planning around how housing will be addressed across the Inuit homelands, will be closely linked to the work of the Tuberculosis Elimination Task Force. But I propose that we have to go further. We have to go further upstream to improve health for the next 150 years. Some of us who trained decades ago, like I did, in medicine, learned a lot about biomedicine. We learned molecular biology and physics and organic chemistry and all those things that somehow you wonder whether they really were all necessary to learn, but they taught us how to think. And somewhere along the way, I began to learn about the social determinants of health. Nowadays, I'm very glad to know that most medical schools at least have some acknowledgement about social determinants of health earlier on in their education. But I believe that we have to go beyond even the social determinants of health, that's actually not far enough upstream to discover the full extent of the causes of the health outcome gaps that exist between Indigenous and non-Indigenous Canadians. And one of the most succinct descriptions of how these gaps have developed can be found in one of the calls to action to the Truth and Reconciliation Commission. And I'm glad to know that you've been talking about the calls to action a lot over the last day or so. Call to action number 18 is the one that speaks perhaps most loudly to me around health. And it says that we call upon the federal, provincial, territorial, and Aboriginal governments to acknowledge that the current state of Aboriginal health in Canada is a direct result of previous Canadian government policies, including residential schools, and to recognize and implement the health care rights of Aboriginal people as identified in international law, constitutional law, and in treaties. So what I love about that call to action is, as a doctor, I feel like it's got the whole assessment all wrapped up into one. I read it like a medical assessment. I see that there's a cause identified of a problem, and the cause is there as well as the treatment plan. So what's the cause of the health outcome gaps that's cited in that call to action number 18? It's that the health outcome gaps are a direct result of previous Canadian government policies. Now, when I've said that before on social media and other places, everyone's like, oh yeah, typical politician, she's blaming it on the past government. Well, let me just make sure that we've got this straight. It is the result of previous Canadian government policies, and not all of those policies have changed. A few of them have, but many of those discriminatory policies that have caused the health outcome gaps remain in place, and there's much more work to be done. But that call also has a treatment plan in place. It tells us what we need to do. It says that closing those gaps requires the recognition and implementation of rights. So the deplorable statistics that you've been talking about today have their roots in the laws, the policies, and the operational practices of this country. We know that for generations, First Nations, Inuit, and Métis were denied rights. They were denied the right to self-determination and subjected to laws, policies, and practices that were based on domination and assimilation. I want to illustrate this, the importance of the recognition of rights by looking at a very specific issue, which I suspect that you've touched on a little bit already, and that's the issue of child welfare. You may note that, in fact, one of the policies that's identified in the Call to Action 18 is the policy around residential schools. And the effects, as I'm sure you've discussed, of this particular policy on individuals, families, and communities from this form of cultural genocide is going to continue to be felt for generations. But many have argued, well, that the legacy of residential schools lives on in another format. The Truth and Reconciliation final report specifically says that, quote, the doors are closed at residential schools, but foster homes still exist, and our children are still being taken away. Canada's child welfare system has simply continued the assimilation that the residential school system started, end quote. Experts have noted that the trauma that was caused by residential schools was, of course, in part related to physical and sexual abuse that children suffered, but also in large part related to the breaking apart of families and homes. And you heard some of that today in the stories that were shared. Children as young as 5 years old, as you know, were taken away from their communities and separated from their language, their land, and their traditions. But very similar trauma continues today. and results in the overrepresentation of Indigenous children in the child welfare system. Census 2016 shows that Indigenous children aged 0 to 14 make up 7.7% of Canadian children, but they represent over 52% of children in foster care in private homes. This is one of the top priorities of our new department. I fear that the next 150 years will not be healthy for Indigenous children and families unless the approach to child welfare shifts. It has to shift from one that gives a financial incentive for the apprehension of children to a restorative approach that prevents the high rates of child apprehension and promotes the important and essential attachment of children to nurturing families, communities, and their own culture. And to that end, we have taken a number of steps. One of the first things that I did in my capacity of this new portfolio was to convene a meeting that we had in January on the topic of Indigenous child welfare, where we gathered together First Nations, Inuit, and Métis from across the country. And on that occasion, we put out some commitments from the federal government as 6 points of action, and I encourage you to look them up and to hold us accountable to those 6 points of action. I was also very pleased that we were able to ensure that financial resources will not be a barrier to addressing the reform that's necessary in child welfare. And we had a commitment of $1.4 billion in the 2018 budget to address child welfare, and we have also made it very clear that we will pay the actual cost for First Nations child welfare agencies in compliance with the orders of the Human Rights Tribunal. I was in Winnipeg last week for 3 days, and I met with various groups on this particular issue. On Monday evening, I had an opportunity to meet with families whose children had been apprehended, but had, in many cases, been reunited. And the First Nations Family Advocate Office in Manitoba has successfully brought 270 children back to their families in the last couple of years, and they believe that they are potentially on track to reunite another 300 children in the next 6 months to their homes. I met many of these parents and children and heard their stories about the impact of the discriminatory policies and approaches to child welfare that currently exist. I also heard about the less discussed consequences of child apprehension, which again were shared with us in a recent news article, in this case in the National Post, that talked about the high rates of suicide among parents whose children have been taken away. You've already heard stories today that I think speak to the trauma of families being torn apart. But at that gathering, I met people like Laura, who some of you may have heard me talk about before. She's a woman who grew up in child welfare herself and became pregnant at the age of 16. And because she was a child in care, her baby was immediately apprehended from her at the age of 16. She went on and had a second and third pregnancy. And in each case, her chart was flagged because she'd had a previous child taken from her, and those babies were taken away automatically. She came to the First Nations Family Advocate Office at the time of her fourth pregnancy and had one simple plea. She said, "All I want is to be able to spend one day with my baby. I don't want to know that they're waiting outside the door while I'm in labor to take my baby away from me, and could you help me to get one day with my child?" She had that baby a few months ago, and very unfortunately, the office was unable to intervene, and her baby was taken from her at birth. I met her last week, and I'm happy to report that she has made progress, and the Family Advocate Office has made progress with her. She's now had a couple of visitations with her baby and is getting very close to the point that she hopes to be reunified with her fourth child. A woman for whom the system set her out to fail right from the very beginning, who had everything working against her, and her one plea to be able to continue to bond with a child was denied. I also met a young couple with their 4 children who told me their tragic story of the fact that they had lived far away from the city. And one of their 5 children at that time had a choking incident. And because of the delays that it took for someone to get an ambulance out to where they lived and to be able to get that child into hospital, their toddler died of choking and asphyxiation. But to add trauma upon trauma, the decision was not to support this family and provide the kind of grief counseling that they needed, but to take away the other 4 children, as if that would be a solution. And to recognize that there couldn't be a restorative way to find out what actually happened and whether or not this family was really in a position to be able to care for these 4 children. Thankfully, again, through the work of the Family Advocate Office, they got those 4 children back. Beautiful, beautiful young children that I had a chance to meet. One more story that I'll share with you was the story of a family who had been reunified, and she said to me, "My joy is tempered by the fact of what happened to my sister last week." And again, it was a young woman who had grown up in care. She and her sister both had grown up in the foster care system. And her sister's kids had just been taken away from her. And she said she couldn't bear what happened, took an overdose, and died by suicide. Unbelievable trauma taking place in 2018, associated with policies, with legislation, with the practices that we allow to continue that will traumatize these people and their families for the rest of their lives. Well, on Tuesday last week, I attended part of a Métis Nation summit on child welfare and had the privilege of hosting a panel of 7 youth who had been part of the child welfare system. And some of them had lived in dozens of foster homes. Their stories were poignant and painful, but their resilience was absolutely remarkable. And the message was loud and clear. As you've heard, the current approach is failing families, and it has serious consequences for the health and wellness of countless Canadians. But on Wednesday that week, I had yet another critical meeting about child welfare, and here's where I'm going to get back to the recognition of rights. I met with the Grand Chiefs of the Assembly of Manitoba Chiefs, the MKO, which is the Northern Chiefs Organization, and the Southern Chiefs Organization. This is in the context of a province that has about 12,000 children in foster care, 90% of which are Indigenous, where the Assembly of Manitoba Chiefs reports that in 2016 there were more than 400 babies apprehended at birth. So what was the request of the Grand Chiefs? Recognize our rights. They said, we have the right to birth and raise and teach and protect our own children and our own culture. Those rights are clear. And where does the TRC say those rights are laid out? In international law, in constitutional law, and in treaties. The path to health, safety, and healing starts with the recognition and implementation of inherent and treaty rights. And in September last year, the Prime Minister stood in front of the United Nations General Assembly and acknowledged that the failure of successive governments to respect the rights of Indigenous peoples in Canada is Canada's great shame. And in February the 14th of this year, he stood in the House of Commons and said that Canada will develop, in full partnership with First Nations, Inuit, and Métis, a legislative framework for the recognition and implementation of Indigenous rights. We will not definitively address health outcomes nor the broad socioeconomic gaps that exist between Indigenous and non-Indigenous peoples in Canada without the recognition and implementation of inherent Indigenous and treaty rights. Permit me to read from Articles 3 and 4 of the United Nations Declaration on the Rights of Indigenous Peoples. It says that Indigenous peoples have the right to self-determination. By virtue of that right, they freely pursue their economic, social, and cultural development. Indigenous peoples, in exercising the right to self-determination, have the right to autonomy in matters relating to their internal and local affairs, as well as ways and means for financing their autonomous functions. Self-determination, autonomy, the free pursuit of economic, social, and cultural development, these are the most fundamental determinants of health and wellness. Indigenous peoples need what was prescribed for them in the Royal Commission on Aboriginal Peoples more than 20 years ago. So in 1996, RCAP listed these 3 things that Indigenous peoples need. Number 1, they need control over their own lives. Number 2, Indigenous peoples need land, resources, and self-chosen governments with which to reconstruct social, economic, and political order. And number 3, Indigenous peoples need time, space, and respect from Canada to heal their spirit and revitalize their cultures. Behind us is a path that is marred by the denial of the inherent and treaty rights of Indigenous peoples. The path ahead requires for all of us to recognize and implement those rights. Which brings me to the last topic that I will briefly touch upon in terms of the next 150, is how we're supporting self-determination in health. Many of you I know have observed health service delivery for First Nations on reserve in parts of this country, and you'll know that those services generally do not function as part of coordinated health systems. Rather, they are the outworking of a patchwork of policies that have evolved over the years, connected with varying degrees of success to provincial systems off reserve. So built on the foundation of the recognition of rights, strengthened by essential investments in the social determinants of health, I believe that the path forward to improved health outcomes for Indigenous peoples must include high-quality, culturally relevant health systems that respect Indigenous knowledge, are rooted in primary care, and are delivered under the leadership and control of Indigenous peoples. The British Columbia First Nations Health Authority is an example. They've been managing health services for BC First Nations since 2013 through a unique governance structure. This is what exercising self-determination in the health sector looks like. Improved health outcomes for BC First Nations are a testament to the success of this approach. And so in July of last year, 2017, Canada and Ontario signed an agreement with Anishinaabe Nation, representing the 49 nations of Northern Ontario, to transform healthcare through the development of a health system designed by and delivered by First Nations. The process is being driven by the determination of the leaders of Anishinaabe Nation, who have recruited former National Chief Ovid Mercredi to guide their work. And most recently last week, when I was in Winnipeg, I also signed a memorandum of understanding with Grand Chief Sheila North of the Manitoba Kiiwetinoong Okanagan to work towards a First Nations Health Authority in Northern Manitoba. Those are just some of the examples of what the outworking of the recognition and implementation of rights can mean. There is much more work for all of us to do on health and reconciliation in the next 150 years. Improving health outcomes for Indigenous peoples, as you know, is a social and economic imperative for Canada. But more importantly, we know that it is also a moral imperative. And I want to assure you today of the Government of Canada's unwavering commitment, grounded in the recognition and implementation of Indigenous rights, to pursue justice and health for all. Merci beaucoup. Chimegwech. Marci. Nakurmek.